Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Let's begin with a question. When anger rises, where do you usually look first? Most people look at personality. They say, I am just short-tempered. They look at stress. They say, my life is too heavy. They look at the other person. They say, they provoked me. And yes, all of these can matter. But now do something more precise. Look beneath the emotion. Look beneath the argument, beneath the raised voice, beneath the heat in the chest and the tightness in the jaw. Ask, why did the nervous system lose its braking power so quickly? How did a small trigger become a full body reaction? Anger is not only a moral event, it is also a biological event. It involves the brain's threat circuits, stress hormones, inflammatory signals, sleep quality, blood sugar stability, neurotransmitters, and nutrient status. So today, focus on one small mineral with a large biological reach, zinc. Do not think of zinc only as something for immunity. Think wider. Think of zinc as a regulator, a quiet participant in brain signaling, antioxidant defense, hormone balance, inflammation control, and neural plasticity. Why does this matter for anger? Because anger often becomes difficult to control when the brain is overexcitable, under-recovered, inflamed, depleted, or poorly regulated. So listen carefully. Zinc is not a sedative. It is not a personality transplant. It is not a substitute for therapy, sleep, exercise, conflict skills, or medical care. But when zinc intake is low, absorption is poor, or the body's demand is high, correcting that gap may help the brain regain some of its emotional steadiness. In a small double-blind, placebo-controlled study published in the European Journal of Clinical Nutrition, young women who took a multivitamin plus 7 milligrams of zinc daily for 10 weeks showed significant reductions in anger hostility and depression dejection scores, while the multivitamin-only group did not show the same change. That is a very specific clue. Sometimes emotional control is not improved by trying harder alone. Sometimes the system needs missing materials. Now ask yourself, why would a mineral affect anger? How can something measured in milligrams influence something as intense as rage? That is where the story becomes clinically important. First, understand the brain chemistry. When anger takes over, the brain is often shifting toward threat mode. The amygdala becomes more reactive. The prefrontal cortex, the part that helps you pause, evaluate, and choose words carefully, can lose influence. Stress hormones rise. Excitatory neurotransmission may become louder. The body prepares to defend, attack, or dominate. So ask, what does zinc do in this system? Zinc interacts with glutamate, one of the brain's major excitatory neurotransmitters. Glutamate is necessary. Without it, you cannot think, learn, react, or remember. But when glutamate signaling becomes excessive or poorly balanced, the brain can feel wired, tense, irritable, and emotionally reactive. Zinc is involved in modulation of NMDA receptors, which are part of the glutamate system. Reviews on zinc and depression have described zinc as a key player in glutamatergic signaling, GABA-related pathways, neuroplasticity, and brain-derived neurotrophic factor, often called BDNF. Translate that into daily life. Imagine your emotional brain as a car. Anger is not always the engine being too strong. Sometimes the brakes are weak. Sometimes the road is icy. Sometimes the steering system is delayed. Zinc may help support several parts of that control system: neurotransmitter balance, inflammatory restraint, antioxidant protection, and cellular repair. Now give yourself a command. Stop treating anger as only a bad attitude. Start treating it as a signal. Ask, what is my nervous system missing? What is it carrying? What is it defending against? What is it failing to recover from? Second, consider inflammation. Why do people become more irritable when they are sick, sleep-deprived, overtrained, or chronically stressed? Because inflammation and oxidative stress can change mood regulation. They can make the brain more sensitive to threat and less tolerant of frustration. A systematic review and meta-analysis of randomized controlled trials in adults found that zinc supplementation was associated with reductions in C-reactive protein, tumor necrosis factor alpha, and malondialdehyde, markers connected with inflammation and oxidative stress. This does not mean zinc is an anger medicine. It means zinc may help calm some biological background noise that can make emotional regulation harder. So ask, how do you control anger better? Do you only count to 10, or do you also reduce the internal pressure that makes 10 seconds feel impossible? Use both. Practice the pause, yes. Breathe, yes. Walk away, yes. But also support the body that has to perform those skills. A depleted nervous system cannot easily act wise on command. Third, look at deficiency and vulnerability. The National Institutes of Health notes that adult men need about 11 milligrams of zinc per day, adult women about 8 milligrams, with higher needs during pregnancy and lactation. Zinc comes from foods such as oysters, meat, seafood, eggs, dairy, beans, nuts, and whole grains, but plant sources can be less absorbable because phytates bind zinc. People with gastrointestinal disorders, bariatric surgery history, vegetarian or vegan diets, pregnancy, lactation, alcohol use disorder, and certain inflammatory bowel conditions may be more likely to have zinc inadequacy. Now ask the practical question, how do you know whether zinc might matter for you? Look for patterns. Do you eat little animal protein? Do you rely heavily on unsoaked grains and legumes? Do you have digestive issues? Do you drink alcohol often? Do you have poor wound healing, low appetite, frequent infections, taste or smell changes, hair shedding, or skin problems? Do you feel emotionally brittle in a way that seems larger than the situation? Do not self-diagnose from one symptom. Do not turn every angry moment into a supplement decision. But do investigate. Ask your clinician about zinc status, diet quality, inflammation, thyroid function, iron status, B vitamins, vitamin D, magnesium, sleep disorders, medications, trauma, anxiety, depression, ADHD, bipolar spectrum symptoms, and substance use. Anger can have many doors. Zinc is one door, not the whole building. Fourth, examine the evidence on mood and anger more closely. The 2010 zinc mood study in young women is important because it measured anger hostility directly using the profile of mood states. The dose was not extreme. It was 7 milligrams of added zinc taken with a multivitamin over 10 weeks. That detail matters. Why? Because it suggests that emotional benefits, when they occur, may come from restoring adequacy rather than forcing the body with high-dose mineral loading. A systematic review in nutrients examined iron and zinc interventions in premenopausal women and included mood domains such as depression, anxiety, irritability, and anger. The authors found controlled evidence suggesting a role for zinc supplementation in depressive symptoms, especially in deficient or clinically relevant groups, though the evidence base was still limited. This is exactly the tone we should keep. Interested, not reckless. Hopeful, not exaggerated. In another line of evidence, studies in premenstrual syndrome are worth noticing because many people experience cyclical irritability, anger, tension, and emotional reactivity. A randomized clinical trial in female university students reported that 24 weeks of zinc supplementation significantly reduced psychological symptoms including anger, anxiety, and depressed mood compared with placebo. A later systematic review and meta-analysis of randomized trials in PMS also reported decreases in anger, anxiety, and tearfulness with zinc supplementation. So ask, why might zinc help some people more than others? Because biology is conditional. If someone is already zinc replete, sleeping well, eating well, and emotionally regulated, extra zinc may do little. In fact, some trials in healthy populations have not found meaningful mood changes. But if someone has low intake, poor absorption, menstrual-related symptoms, inflammation, depressive symptoms, or high physiological demand, zinc may be more relevant. That is the key. Match the tool to the person. Fifth, use zinc correctly. Do not begin with megadoses. Do not assume that more is better. The NIH lists the adult tolerable upper intake level for zinc at 40 milligrams per day from food and supplements combined, unless medically supervised. Doses of 50 milligrams or more for weeks can interfere with copper absorption and may reduce immune function or HDL cholesterol. Excess zinc can cause nausea, dizziness, headaches, stomach distress, vomiting, and appetite loss. Zinc can also interfere with certain antibiotics if taken at the same time. So here is the practical command. Build the foundation with food first. If you eat animal foods, include zinc-rich choices several times per week. Oysters if available, beef, crab, lobster, fish, eggs, yogurt, and cheese. If you eat mostly plant-based, use beans, lentils, chickpeas, pumpkin seeds, nuts, oats, whole grains, and fortified foods, but prepare them intelligently. Soak beans and grains. Use fermentation when possible. Pair plant foods with organic acids such as lemon juice or vinegar. Why? Because preparation can reduce phytate interference and improve mineral availability. If supplementation is appropriate, choose a moderate dose and a clear plan. Many people do better with smaller daily amounts or short courses rather than aggressive dosing. Take zinc with food if it upsets your stomach. Separate it from quinolone or tetracycline antibiotics as advised by a clinician. If you are using zinc above ordinary dietary levels for more than a brief period, discuss copper balance with a qualified professional. Now connect zinc to anger skills. Do this. When anger rises, pause and name the state. Say internally, my threat system is activated, then breathe out longer than you breathe in. Relax your tongue from the roof of the mouth, unclench your hands, delay your response, drink water, step away if needed, but do not stop there. Later, audit the body. Ask, did I sleep? Did I eat enough protein? Was my blood sugar unstable? Am I deficient? Am I inflamed? Did caffeine, alcohol, or poor recovery make me easier to trigger? This is how zinc becomes part of a serious anger control plan. It is not take zinc and become calm. It is restore the biochemical terrain so your psychological tools can actually work. Think of the person who says, I know what I should say, but in the moment I cannot access it. That sentence matters. Anger control is not only knowing the right response, it is being able to access the right response under pressure. Nutrient adequacy helps the brain remain available to itself. Sixth, respect the limits. If anger includes violence, threats, self-harm, panic, mania, severe depression, substance misuse, or loss of control, seek professional help immediately. Do not treat dangerous anger with supplements alone. Use therapy, medical evaluation, safety planning, sleep treatment, and sometimes medication when indicated. Zinc can support physiology. It cannot replace accountability, skill building, or urgent care. And ask one final why. Why is this approach powerful? Because it removes shame without removing responsibility. It says your anger is real and your choices matter. But it also says your body may be making those choices harder than they need to be. That is a more humane and more medically informed way to work. So remember this, anger is fire, but the nervous system is the climate around that fire. Zinc may help some people by supporting neurotransmitter balance, reducing inflammatory and oxidative pressure, assisting brain plasticity, and correcting a nutritional gap that can quietly affect mood. Use zinc wisely. Start with food. Assess risk factors. Consider testing and professional guidance. Avoid high-dose habits. Protect copper balance. Combine nutrition with breathing, sleep, exercise, therapy, communication skills, and honest repair after conflict. Ask yourself every day, how can I make my brain easier to calm? How can I make my body safer for my mind to live in? How can I prepare before anger arrives instead of apologizing after it leaves? That is the real lesson. Do not wait for the storm to practice balance. Build the balance before the storm. Take care of yourself, take care of each other, and keep growing together as one family of learners. I'll see you in the next topic.